Hello, everyone, and welcome to today's webinar, Engage Patients, Empower Staff, Real-World Strategies That Work. My name is Matt Harrell. I'm on the marketing team at Clearwave, and I'll be your moderator today. Before we get into today's session, I'd like to cover just a couple housekeeping items. Phone lines have been muted to maintain sound quality throughout the session, but we should have some time for questions at the end. So feel free to input questions as and when you have them in the chat box you'll see on your screen. This presentation is being recorded, and we'll send a copy of that to all attendees here today after our session concludes. I'm really pleased to be joined today by two very special guests. Ruby Pezanetti, Chief Operating Officer at Edward M. Kennedy Health Center, as well as Allison Williams, Solution Consultant at Vital Interaction and longtime FQHC practitioner. Ruby, Allison, thanks so much for joining me today.
Thank you, Matt.
Thanks for having us.
Awesome. Well, I know we've got a lot of content to get through, a lot of great discussion to be had. I thought we could just start today by, Ruby, having you give us a little bit more information about Edward M. Kennedy Community Health Center. Do you mind giving us a quick overview?
Absolutely. First, Matt, thank you and Clearwave for hosting this. Always excited to share some of the work that's going on in the field. As the Chief Operating Officer of the Edward Kennedy Community Health Center, I have the pleasure and the privilege of really focusing on our mission, which is helping people live healthier lives. We are in the Central Mass and Metro West area of Massachusetts. We have 4 clinical sites, 6 school-based health centers. We serve over 34,000 patients annually, and on average, we translate in over 80 different languages every year.
Wow. A lot of locations, a lot of providers, and a lot of services that are super important for the areas in which you serve, Ruby. So appreciate that. Allison, I'd love to bring you in to the discussion here to really kind of kick us off and, talk alongside Ruby about, this balance between patient experience and optimizing that, while also maintaining some of the operational things that are critically important at a health center. So I'll kind of pass it to you to navigate that with Ruby.
Absolutely. Thanks so much, Matt. Yeah, there is that unique balance that must be struck between, caring for our patients, caring for our community, and keeping the doors open and lights on, right? And so making sure that there is a balance and that there are successful outcomes on both and all sides. Working with community health centers and talking to leaders like Ruby, that is something that is such top of mind at this point in time, given the environment, and making sure that we are paying close attention to those who are growing more and more in need. So with all that, thinking about your health center, Ruby, well done, great community. I think I've driven by it at different points as I've gone down the pike. So it's a large health center, right? Like the 50, like you mentioned, 57 providers, a variety of different kinds of locations, and talk about languages. What a variety that you of the patient population that you serve. So what I'd like to try and do is, knowing all of that, is taking us back to the place where Edward M. Kennedy made the decision to try and think about the transformation of moving forward with different kinds of technology versus just what was within the EMR platform.
Thank you for that question, Allison. As I reflect back, I joined the organization back in 2022, which was a tremendous year of growth for us. We were on the cuffs of the pandemic. We were in the process of expanding access to care to our patients by building 2 new clinical locations. And one of the things that was really important and at the core of the work that we do is making sure that our patients not only enter an environment that feels welcoming and supportive, but at our teams also had the infrastructure in place to really support and drive the patient experience, where that regardless of what site you go to, we say this a lot, I don't care if you're seeing in our Worcester location, in our Milford location, or our Framingham location, the patient experience feels the same, right? They feel welcome, they feel supported, they feel part of the community, and that community is there to really educate, embrace, and support them through their journey of healthcare. As of FQHC, as you know, we have a duty and an obligation to see patients regardless of their ability to pay. And so one of the critical operational challenges that we face was how do we identify patients who are there for scheduled appointments versus the volume of walk-ins? So like I said, when I joined the organization, I heard anecdotally from a lot of my operational front desk teams that, you know, they were challenged and that lines were long, which would then create a backup for our provider teams, right? The longer it took the patient to be able to register, the longer it took for them to get to the back and be seen by their providers. We really wanted to address some of those gaps. And we looked at a myriad of solutions. I think we researched a total of 10. We got down to about 5. We had demos across with all 5. And, you know, we were really quite impressed with Clearwave. And we ended up going and moving forward with that for a number of reasons. The first is the breadth of the platform. They had capabilities for even the type of kiosks that were available. They had specific kiosks that could be placed on desks for ADA compatibility, right? Versus standing kiosks which staff could use, which was really significant because oftentimes a lot of vendors overlook some of those challenges that maybe our elderly or our disabled populations often face. So I thought that was very important. The second piece was the language capability. Like I shared earlier, we serve a great deal of languages, and working with a vendor that could partner with us to really support that language capability was critical. The third element that really stood out to us was Clearwave's integration within EMRs, right? So it gave us the ability to not only capture information accurately directly from our patients, but that information can be fed both on the EPM side, which is the practice management side, as well as the EMR side, which is the medical record. So that gave us a lot of hopes for the future. It reduced redundancies, it reduced a lot of data entry, data accuracy, updates to our demographic really were able to become seamless as a result of our implementation of Clearwave. And I think overall, the value that we were getting for the cost was really critical. One of the elements here is how do you balance, right, the needs of your operations with your duty to make sure that whatever solution you move forward with is not only financially viable, but sustainable, and that you're getting that value and that ROI from that. And we really felt that partnering with Clearwave really gave us the best of both worlds. And that's why we move forward with that solution.
Completely makes sense. Thank you for that. And, you know, it's the old adage, no margin, no mission, right?
Absolutely.
And we have to be very mindful of that as we work towards efficiencies and, you know, trying to keep things in that and strike that balance between patients and revenue generation, finding, cost preserving, et cetera. So that's really awesome. Thinking about, I think next slide. So when we take a look across the continuum of a visit with for a patient at a health center, we think of a couple of different buckets, right? We think about pre-visit, things that happen within the visit with the care provider, clinician, and then stuff that may be happening in between those visits for continuing that care with those patients. And it starts, you know, pre-visit, thinking about screeners and eligibility checks and understanding what maybe there's a referral or prior auth or other information that you might need prior to the visit, and then during that visit being able to take the POS collections and what is true patient responsibility, and then that deeper level of communication and outreach to patients in between their visits, whether it's a reminder or a I'm sorry we missed you no-show call, or whether it's the fourth quarter, it's heading towards Christmas time and we haven't seen you in for your diabetic visit or to check your eyes or to check your feet. Please come in a very, in warm, caring way to our patients, that they can not only receive that information, but receive it in the right time, in the right way, in the right context, whether text, email, provider recorded calls, so that it is to that deeper, meaningful level. And what took place at Edward M. Kennedy, from what you and I have talked about, is you didn't just fix or adjust or fine-tune one part of the patient journey. Rather, you tweaked quite a bit, right? And so I'd like for us to, if you please feel welcome to comment on that, and I'd like to step us through a little bit of these parts and components of the patient journey.
Absolutely. I think what's really critical for us when we think about pre-visit, the challenges, the front desk team, and quite frankly, the impacts of some of our decision making at the front desk to the back of the house and billing, right after that encounter is done and submitting it. Making sure that eligibility verification was being done upfront. Love the fact that Clearwave checks eligibility 7 times before the actual schedule appointments, right? So our teams was not only getting the eligibility check, but they were getting flags identifying when there was a gap, right? Rather, they were uninsured or underinsured, and they were able to be proactive and leverage that to make referrals to our in-house navigator team to schedule patients to be able to be educated about insurance, as well as apply for insurance before their visit, which was extremely critical. The other element that we did is in year 2, we really worked with Clearwave to develop the ability for online scheduling. When we talked about earlier about the difference between patients walking in and the volume of patients who were there for appointments, we learned from tracking our data that the majority of the patients who were coming in for walk-ins, over 80% of them, were walking in to schedule an appointment. Many of our patients really do struggle with some social determinants, whether it's transportation to be able to come to their appointments. So that really broke our hearts as we thought about, wow, a patient getting on 2 or 3 buses just to be able to schedule an appointment. So we worked with Clearwave to develop some solutions to put some online scheduling, so that rather than having to come in to schedule your appointments or schedule follow-ups or to reschedule, or waiting on the phone for a call center rep to be able to do that, they're able to go online directly and do that themselves. We love the appointment reminders to the point where patients were coming to us and were saying, okay, enough, right? So we do a 5-3-2 with appointment reminders, where 5 days before the appointments, 3 and 2, they're getting them. And if they complete everything up front, they don't get the reminders. So I like that flexibility, right? They're getting reminders as they need them for the things that they need. Pre-registration was also critical. They're able to complete those steps, as well as the clinical intake. Our clinical support team, our MAs, are so grateful for the clinical intake, because that was a lot of manpower hours of them calling patients in advance to screen them for the different elements. Now patients are able to get that upfront as part of their reminders completed, and more importantly, that data feeding right back into our EHR. So that allows our providers to also prep for their visits. They're able to see the answers on the screenings and be prepared to ask questions and talk about what's a good plan of action for those intake questions. And then lastly, the educational content, which for new patients was amazing, because as they were scheduled for their new appointment, we could work with our medical directors to create videos to welcome them to our practice, right? So by the time they came in, they knew this is the location, this is the medical director, here's how our practice operate, and here's what you can expect from your visit. So it really helped us educate our patients to be prepared for the healthcare experience and that journey.
It's so welcoming, and acknowledging for a patient to actually visually see a recording of their provider welcoming them to the health center, or listening to their voice on the recording. It's actually Dr. Smith, right? And so that's really, it's really personable and a way to acknowledge. And one thing that I did want to bring up, and is a piece of make sure I made mention of, is with the contact card and communications with the patients, is that all communications, whether it's a text or a call or an email, comes to those patients by way of a visual of Edward M. Kennedy's brand and logo, and so that patients absolutely know where that communication is coming from, and so that they can be more responsive and pick up that call, answer that text, and continue to communicate with their care provider. Before we move on to the next, sorry, go ahead.
What I love is that they can save that contact card, right? And so especially like right now is the holiday season, there's a lot of fraudulent activity. Being able to have that information stored in your phone, you can trust that the information that you're getting via text is coming, or by phone call, is coming from a trusted partner.
Absolutely, it's awesome, and that's yes. I did want to ask you before we move on to the next next section. Was there any kind of adoption surprises, whether it was as you rolled out Clearwave and Vital Interaction? Were there any oh my goodness, shockers and pleasant surprises along the way, whether it was for patients, your team, providers, even anybody in the community? Is there anything you'd like to share from a pleasantry standpoint?
Yeah, so there were good surprises, right? And what I like to call opportunities. One of the first learnings that we did was just the volume of adoption, right? I think a great deal of people are afraid of innovation in the technology because change is hard. It's hard for people to adjust to change, and B, we want to make sure that regardless of the age or the population, they're able to easily use it. And I think what was the biggest surprise is how quickly our patient population became comfortable with the kiosk and using the kiosk. But that was really part of a strategic approach to implementation. When we rolled out, we made sure that our front desk patient associates were standing at the kiosk, educating and helping patients through that first interaction. Once they were able to get that level of support, every other patient appointment, we just saw processing time getting shorter and shorter. I think we started at 5 minutes, then it dropped to 3 minutes, and now our average is 2 minutes or less to be able to complete your registration when you come in. So I think that one was a beautiful and wonderful surprise for us, because a lot of people thought that this would be difficult for various populations, and it wasn't. They were comfortable with it, just like they saw it in terms of, oh, I go to the bank, the ATM machine is a type of kiosk, right? Or I go to the supermarket, checkout, that checkout is a type of kiosk. They were able to adapt to it fairly quickly. So that was really a wonderful value added. I will say the biggest learning we received was we serve a great Hispanic populations from across all of Latin America. And one of the biggest changes was changing our date format, right? So in America, it's month, day, year, and most European and other countries, it's not in that format. So just switching that format made it much easier for our patients to be able to put in dates and dates of birth for us to be able to capture and update for them. So that was a great lesson learned.
Awesome. And talk about the accuracy now, huh? That's amazing. Yeah. Wonderful. Next slide, please. And then are you thinking about during the visit? itself. So we've done all these nice enhancement and created some great efficiencies and, you know, great opportunities for the organization, the patients. And so now thinking about the visit, what has really changed in terms of digital check-in and now that automation is more fully alive and moving forward? Did you see any kind of immediate improvements within check-in, or did staff actually come up to you and say, my day got better because of some sort of change that folks embraced in order to feel that? So I'm just curious.
Sure. I would say the key elements from the patient and the staff perspective. From the patient perspective, they love the reminders, gave them the opportunity to say, yes, I'm going to be able to make it, or no, I need to reschedule and change and get that done quickly. For the staff, they were able to prioritize their work and really focus on the value added piece of their work, right? So instead of going to 10 different web pages to verify insurance, it was just, here are the ones that doesn't have insurance, right? It saved them a lot of time and energy on really targeted tasks that they would be doing. For our clinical team, I talked about the clinical intake, those pre-screening questions. Our MAs were just like, thank you for the time you gave us back, right? When you think about the hours of phone calls that they were making, leaving messages, not being able to connect with a patient. And the piece that I loved during the visit, so even if they were unable to complete it in advance, all of our MAs actually have on their badge, it's a little Clearwave attachment with the QR code for the intakes. So as they're getting the patient ready for the provider, if the patient didn't complete it, they can have that patient pull out their phone in real time, scan the QR code, and start completing that intake. That information is feeding to the provider in real time, right? So again, the providers felt a lot of value add in that they were able to take time to review the responses, understand the types of questioning they were preparing for when they come into that visit. And it really is an outcome of being able to do that intake either in advance or in real time, or they knew what wasn't completed. And so they can spend that time focusing on what didn't get done to really talk about that. So I think that made it extremely, extremely beneficial, not just for the patients, but as well for our staff to be able to focus their time and their priorities on the task that was going to bring the most value. And so we weren't spending a lot of time updating demographic during registration. And one of the key elements we saw is our wait time went down, right? Because it took less time for patients to be able to update. And two areas in the Clearwave platform that I love is that there are schedule updates, right? So if there's a consent form that needs to be signed every year, that patient is going to get that reminder in that year to do that consent form. That's extremely valuable for our patients and our staff, and from a compliance perspective, right? For the organization, you know that that task is getting done. The other element that was critical, which I would say really was a key factor in us getting a perfect score and our HRSA operational site visit, is the sliding fee scale. Thank you. One of our pre-screen questions during intake is the family size, as well as the household income, which are two of the elements that you use to screen a patient for eligibility for sliding fee scale. So now, again, our staff could focus on getting those who are eligible and could benefit from it, the application, and working with them with the application. And we could ensure that all of our patients was getting an opportunity to share that information and capturing it for compliance as well.
I think that's wonderful. Yeah, congrats. That's amazing. Good work on that on-site visit. And yeah, being able to collect that information for the sliding fee program in a consistent, reliable manner is huge for compliance. Absolutely. All right, we're going to move to the next slide. And thinking about in between visits. So, communications with our patients, whether it's email informational, two-way texting, some kinds of mass messaging, even a happy birthday, right? Which can be delivered to your patients, and then reactivations. And when we say that, we talk about our care gaps, right? Those patients who maybe have not been in for a hypertensive follow-up. And we want to get not only the patient well, but also to, be successful for UDS reporting and other types of payer type programs where you're focusing on particular disease states. And of course, getting those patients back in, and calling them and bringing them in. So thinking about these areas, what did Edward M. Kennedy what kind of impact did folks feel based on these kinds of activities that you were able to engage with?
Absolutely. So that one's an amazing question, because all FQHCs really have some pretty strong quality metrics and measures that they have to meet and achieve throughout the year for their patient population. It's our duty and our obligation contractually with CMS, as well with our Medicaid service provider, Mass Health. Vital has been a game changer for us in this area. So what we do is, as we track our various quality metrics and measures, to your point, right? You see the patient care gaps, and what you do is our clinical team work in partnership with our population health team. So population health is able to identify the gaps, work with our clinical team to develop a plan of action. And this is where Vital Interaction has been instrumental in delivering on what we call our call to actions. So for example, blood pressure checks, we need them to be done at a certain interval. We're able to run the report, work in partnership, go on the dashboard with Vital Interaction, identify that patient population, give them the listing, work with them on developing the right messaging and what the call to action is, right? Rather, the call to action is, hey, click here to go online and schedule that follow-up appointment. Or, right, would you like a phone call back from us so we can discuss it? It has been critical. So from things as those care gaps to your point earlier, the no-shows, right? Even if patients aren't able to make their appointments, we're leveraging these campaigns in Vital Interaction to say, hey, sorry we missed you. We'd love to understand what we could do differently to help ensure that you make your next appointment. So we can have them take a quick 3 to 5 question survey, right? What was the barrier from you getting to your appointment today? What could we have done differently? Do we need to change our hours of operation? So we're able to capture all of that through this one interaction with our patients. The other element that I really love that Vital have is this layering component, right? If a patient is coming up for multiple interaction, we're able to manage that in a way that's meaningful for the patient so that it doesn't become sensory overload where it's nonstop text from the health center, right? So they might get a more robust communication that says, please, do this or do that, right? And so it's 2 different campaigns, but it's combined into one. So it's easier for the patient to kind of understand what it is the outreach is about and what they can do to follow up with the organization. The other element that is been critical to my population health director, and I wish she was here today because she would be singing the praises of Vital, is the ease of use with the team and the platform and the reporting on the back end. It has just been so critical for us to be able to track that ROI. We talked earlier about balance, right? Operational needs, patient needs, and our fiscal responsibility to the organization. We were able to really track the effectiveness and the efficiency of the campaign for the ROI. So one example of that, we used a campaign for when a provider left our practice. So historically, we would pull the panel of the provider and send a letter to every single patient. So what we did is, instead of printing thousands of letters, we released that through a campaign via Vital Interaction, via text, letting them know your provider is leaving the practice. Here is the providers that are within the care team that are available to support you, and feel free to use your online scheduling if you need to schedule a follow-up appointment with your provider, because the care team will be available when you go on to Clearwave scheduling. So that has been really instrumental for our patients. But then we were able to get back a report the next day after we sent out that campaign. This is the number of texts that went through. This is how many responded. And, we talked a little bit earlier about what are some of the good things that we learned. One of our best learning is, if you're going to send out a campaign with a call to action, make sure you have the resources and the staff to be able to support the call to action. We also did a campaign to update general compliance notice to patients. We sent that to our entire, over 34,000 patients. Took us less than 30 minutes to send that out, right? The next day, our call center sent me an email. Ruby, what is going on? We are just getting nonstop phone calls from patients about this. So it really taught us a lesson about, like, all the different campaigns that we're doing, is to make sure that we have all of the key stakeholders tuned into what those campaigns are, and that they, A, have general awareness, and B, the teams that are going to be supporting the call to actions, that you have the resources available there to support them. So those reporting has been instrumental. We were able to really calculate how much money we save, right? We did an initial one with 600 patients, and only 87 patients where that number wasn't accurate for them, right? So that gave us an opportunity to update our demographic information.
For sure.
The email wasn't accurate for them. And so we were able to calculate in true dollars and cents how much we were saving with every mailing. So if you think about, right, the cost of stamp, every piece of paper that comes in a ream of paper, the amount of ink on your printer, and the amount of staff time it takes to collate all of that, put the stamp on there and send it out. We're saving thousands of dollars now a year on those, because now we're able to communicate with our patients very effectively and in a way that is convenient for them.
Love it. Love it. Those are very good surprises, being able to feel that success. But and I appreciate you saying too, be mindful of the resourcing, because the power this has, we want to be able to make it a good experience for those patients who do want to come in and visit with us, etc. So yeah, definitely, it is a very powerful kind of mechanism to be able to communicate with your patients in a super meaningful, personalized way. So yeah, that's great. Next slide, please. And so thinking about technology and technology rollout, and all of this stems from the idea of change management. I'm just going to put it out there. And so I'm just going to put it out there. And so how did you successfully roll this out? I know you have to consider resources and timing and the season and the moon and the stars, and because things change so wildly at health centers. The Joint Commission's coming in on the go live day. So there's different things that you had to either overcome, consider, think about as you adopted these pieces of new technology. And so if you wanted to share with us a little bit about who were the naysayers and how did we overcome that, and oftentimes they have very good valid points in order to consider and things like that. So I'm curious to know how you believe and how successful your rollout was, and the things that contributed to making it successful.
Absolutely. This one's, I think, is probably the most critical element for practice leaders in an organization, right? Like I said earlier, change is hard. One thing we're promising guaranteed, but one of the hardest things for people to really accept and deal with. And I think overall, our philosophy on change management is that at our core, we have to educate and help all of our stakeholders understand the value for the patients. Because as a health center, we exist for our patients, right? In the communities that we serve. And if there is value for the majority of the population that we serve, then we have a duty and responsibility to look at what technology is available to support and help our patients have the most optimal experience when they come to us in healthcare. Why? Because they're usually coming to us when they're feeling their worst, right? And the easier you make that for them, the better it is. And technology is not the end all be all to everything. There's quite a lot of value to the human interaction and the importance of that. But there are times where technology can really help and support your organization be more efficient and more effective in the delivery of the services to your patients. So what we typically like to do is we start with the end users, which I've been in a lot of organizations, that's not always the case. But the people who are going to use the tool of the technology, those are the ones I hear from first. What is working for you? What isn't? Here's the challenge we're facing as an organization. What do you think are some of the contributing factors? And what would be beneficial to you in your job and in your role? And then as we research vendors and we identify vendors, we ensure that our stakeholders are part of those vendor interactions, right? They get to see upfront the features and benefits of all vendors. And what we typically do is we ask our team members to do an assessment of those vendors. And then we do a roll up of which vendors or got the highest scores versus others. And that kind of really determines which vendors we move forward with within our organization. But I think what's the most important is in that process, you are able to identify who are going to be your champions, right? And who are going to be those individuals you got to really, you got to give them the WIFM, right? What's in it for them? Why is it going to be beneficial for them? And you're also going to have that small subgroup that maybe just doesn't agree with this change, right? They don't agree maybe with the change or the pace or the speed or the timing, whichever one, right? And you have to be prepared and have a plan for all of that. And so what I often like to do is leverage those end users to be part of the decision-making process. I think that's extremely effective in helping them understand what's the value in it for them and the work that they and their teams are going to be doing, as well as leveraging those who really can be our champions to really become our ambassadors throughout implementation. They're going to be the people that participate in our testing groups. They're going to be the ones that go back and ask the naysayers, hey, I know you've had this challenge. If we could do this, would this help you, right? And really be that glue for us between the technology and the work that they do. But all together, again, always, whatever rollout and implementation you do, the bigger picture has to be what's the value for the patient and how it aligns with the mission of your organization. When people understand the why of the technology and the value that it can have for both our patients, for themselves, and the organization overall, I find that we usually have a really high rate of success. And one of the key elements I ask my team to do prior to implementation is to tell me how they would define success. What does that mean at the end of implementation? And then once we implement, we then go back and we basically assess ourselves. Did we meet what the standards were for us? And if we did, then we can say we were successful. And if we weren't, then we have an opportunity to learn from that and think about what we do differently for the next implementation.
That's a beautiful, beautiful way to approach it. It really does contribute to greater success with seeing things actualize and become more efficient and better the, and make the community and the service better for your patients.
Yeah, I think it's also very helpful to help people make technology simple. We make it too difficult sometimes, right? And so, like I said, being able to connect like day-to-day things people do, like instead of like that kiosk, I said the ATM and everybody in the room was like, oh yeah, now that you say that, I get it, right? Like
for sure.
Like if you can make that connection, make it easy for them, your teams and your patients are able to understand and capture what the technology is, what it can do for them a little bit easier. And lastly, I would put the part of always have a continuous loop for improvement, right? don't ever set up implementation. And I think that's something I value more and more from vendors like Clearwave and Vital, is that we have that ongoing touch point, right? Whether something isn't working the way we thought it would work, like that date of birth format, right? Or there's value to doing something else. I think having that loop and having that available for your teams were critical. We actually keep a spreadsheet on Go Live. Any issues that a staff experience, we document it so we know exactly what it is. And then at the end of the day, we're able to sit down with that implementation team and debrief. Like, what went wrong? What could we be doing differently? Or do we need to add more in a training component? Having that continuous feedback loop, not only throughout implementation, but at least ongoing for a year after you implement, makes people feel comfortable that they know that you care about their feedback on the tool and making the tool the best that it can be for them and the patients.
100%. That partnership goes so many miles down the road together. When there is that partnership between an health center and their vendors, that is it is not only just continuous communication, it's partnership. It's truly understanding what is important to that health center and to the patients of the community in order to leverage the product in a more meaningful way for the health centers, for the safety net, for FQHCs as a whole. That partnership creates longevity and efficiencies and strength in the long run. So yeah, I completely agree with you. And next slide, please. Thank you. Oh, these are our results. And as we think about these things through the patient journey, pre-visit, during the visit, and post-visit, and in between visits, here's some of the awesome statistics that we were able to derive from Edward M. Kennedy's experience. So I'd say pick one out of each and please do tell. These look lovely.
I would say that the under pre-visit, again, I think the adoption of the tool in advance and those clinical intakes were critical. But more importantly, being able to reschedule and connect our patient with resources that they need in preparation for their visit was absolutely critical. During the visit, that first one, that adoption of the kiosk, again, like mind-blowing for our teams. And we saw the difference in that approach of how quickly the patients were able to adapt to the technology. Now it's to the point where they just walk straight to the kiosk. They only come to the front desk if they really need them. But they know, like, I come in, I do this, I'm going to get in quicker, everything's going to process quickly. And you're able to really see like the patients with scheduled appointments versus the walk-ins, right? Because the walk-ins are coming to the front desk, but your scheduled appointments, they know to go directly to the kiosk. And in between and post visits, like I said, the ability to do that follow-up work with our patients when it comes to the quality outcomes, right? Whether it's blood pressure, diabetes, vaccinations, we're able to consistently stay in touch with them. And we see their re-engagement and their reactivation rates with us continue to go higher with every new campaign that we do.
Just beautiful. Thank you for sharing those. And next slide, please. And so that brings us to closing our time together, Ruby. It was just an absolute pleasure. Thank you. And your health center is doing some amazing work with a lot of different tools and technologies and increased efficiencies. And so thank you for that. And we'd like to know if there's any questions that folks would like to ask us.
Yeah, amazing. Thanks so much, Ruby, Allison. Great conversation. I think I'm really just struck by, all of the small pieces that go into the patient journey that end up being critical for some of the success that we saw on that last slide, which I think is extraordinarily commendable for what Ruby and her team have been able to accomplish. As Allison mentioned, we'd love to take your questions. I'm just monitoring the chat here, and I know we're a little short on time. There was one that came through that I feel like we'd be remiss in not asking. This one is for you, Ruby. This person asks, what are your priorities for 2026, and do you feel like AI has a part to play in those plans?
Thank you for that question, Matt, and to the viewer. I think our top priorities coming into 2026 is twofold. One is we're planning and prepping for a new EHR implementation, which is a significant undertaking for any healthcare facility. And so as our teams prepare for that, we're taking the change management approach of prepping and asking three key questions. Knowing the tools and the solution, what are we going to stop doing? What is new that we need to do? And what needs to be changed from what we do today? And I think, again, keeping major technological changes simple and easy for teams to understand. So rather going into every single elements of tools and benefits, which we'll get to during the implementation process, having teams spend their time and their resources evaluating their current workflows, the current tools that they have, and just asking themselves those basic three questions. Is this something that we're going to need to stop? What do we need to create that's new? And what do we need to make adjustments to? I think has been very helpful and critical. With the decision to move to a new EHR, really is to leverage a lot of the new technology that is available out there in the world of AI, but do it in a way that is responsible. I think too often with technology, people get excited about what it can do, but we have to think about the fact that as healthcare organization, we're in a highly regulated industry with a lot of requirements upon us for privacy, security, protection of data and information. And so what we're taking the time now is we have a beautiful committee, an AI committee, working on developing the governance document of how we will be using and implementing AI functionalities within the existing tools that we have, as well as how we're going to be evaluating them for future tools.
Great. No, that makes total sense. And so just an EHR change next year. So pretty, I'm sure boring, sort of year ahead. I'm sure you could sense my sarcasm, but
Absolutely.
I know you've got the team in place and the structure in place that we kind of covered today to make that as seamless as possible. So just in the spirit of time, I know we're running a little over now, but such great discussion today, Ruby and Allison. I just want to thank you again for taking the time to share some insights with us today. I know our audience will be able to glean some actionable tips for, especially as we're going here into 2026. I'd also like to thank everyone who joined us for the session today. For anyone that's interested in more information about some of the solutions that Ruby talked about from both Clearwave and Vital Interaction, feel free to drop the word demo into the chat and we'll follow up with you accordingly. Also looks like a couple additional questions popped in. I'm sorry we didn't get to answer those live, but we will follow up with you just right after the session here today. So thanks for asking those. We'll get to you. But on behalf of both the Clearwave and the Vital Interaction teams, I want to wish everybody a happy holidays to round out the year. And thanks so much for spending the time with us. We hope you have a great remainder of your year. And we hope to see you for a session in 2026.
Excellent. Thank you.
Thank you again. Take care.
You too.